Good evening, everybody. In today's lecture, let us try to learn about antidepressants, toxicology of antidepressants. First, we will go with introduction of depression. What is depression? Different mechanisms of depression, and then we'll try to see antidepressants, and finally, we'll also cover toxicology of antidepressants. Okay, so let us first try to understand what is depression. So depression is nothing but it is a mood disorder. Depression actually usual depression is very common. See, acute in some time after writing the exam, if we fail in the exam, and if we have any some issues with the family, or if faculty, or if anybody, or if our friend tries to hurt us, so suddenly kya hoga? We will be depressed. That particular type of depression is not actual depression, but if anybody has mood disorder that causes persistent persistent feeling of persistent feeling of sadness persistent feeling of sadness, याद रख लो, persistent feeling of discourage, persistent feeling of anorexia, खाना वाना खाने में इंटरेस्ट नहीं रहेगा, anorexia, and patient will have sleep disturbances means patient sometimes has excessive sleep, hypersomnia bolte, and patient also has insomnia. Both sleep disturbances are commonly seen, and sometimes patient will have hopeless feeling. Okay, and if patient has clinical depressions persistently, patient may also have suicidal thoughts. So see, if a person has feeling of sadness, discourage, anorexia, sleep disturbances, hopelessness, suicidal, और इसमें बहुत सारे आएंगे, all these symptoms if patient has persistently for few weeks to months, that person is considered as clinical depressed person, or this mental condition, or this mood disorder is called clinical depression. So simply, clinical depression is nothing but it is a mood disorder that causes persistent feeling of sadness, discourage, anorexia, sleep disturbances, suicidal thoughts, and all. Okay, so this is called clinical depression. And sometimes see, when person has depression, always along with depression patient also has some other mood disorders, patient also has some other psychological conditions, like patient will have mania. Immediately after depression, patient will have mania means hyperactivation. So the association of mania and association of depression, these two conditions is called bipolar disorder. So bipolar disorder हो सकता है, mania हो सकता है, and depression also can be seen. So these three conditions are different conditions. If patient has depression, and along with depression if patient has mania, that is called bipolar disorder. But individually patient may have depression or patient may have mania. Okay, and one important point you have to remember. See, when epidemiological data is taken, few researchers what they are telling, clinical depression is mainly seen in females. Prevalence rate is more in females. Epidemiological data what they are telling, approximately 20% of females worldwide are suffering with clinical depression, and approximately 12% of males are suffering with clinical depression. So prevalence rate for females is higher than compared with males. Why? Because see, one more point, most females will face clinical depression particularly during or after birth, which is called postpartum depression. Okay, so after deliveries most females will have this kind of symptom. So because of this reason also females are having more prone to depression. Okay, these are some basic things we need to understand. Now you see, to understand depression in detail, let us try to understand the causes. See, till now we don't know how depression is caused. Depression का exact cause अभी तक किसी को पता नहीं है, but we have some mechanisms. We have so many mechanisms for depression. See, for causes of depression we have mainly genetic cause. If our parents, if anybody's parents are having depression, so their offsprings or their children also will have 3 times more risk of getting depression. So genetic cause is one cause, and there is another very important cause is biological cause, and sometimes environmental causes also. environmental causes also patient may have depression. So in environmental causes, usually if patient has alcoholic, if patient has society issues, relationship issues, or if patient has if anybody dies in the family, okay, if anybody loses in the family, or if anybody has physical abuse, or if anybody has sexual abuse, okay, so all this comes under environmental factors. So all environmental factors also may cause depression. Okay, so environmental factors and genetic factors are having very less contribution, but the major contribution of depression is biological cause. In biological cause, we have mainly three neurotransmitters. Yaad rakh lo, we have three neurotransmitters which will which will cause depression, or which is mainly associated with depression. Yaad rakh lo sab log, depression is caused due to the deficiency of three neurotransmitter. Number one, serotonin, which is also called 5-hydroxytryptamine, 5-HT, 5-hydroxytryptamine. Very, very important. This is one. If patient has deficiency of serotonin, patient will have depression. Or if patient has deficiency of dopamine, if patient has deficiency of dopamine, patient may have depression. And the third one is very important, if patient has deficiency of noradrenaline. Noradrenaline. So this actually, it is a hypothesis. This is called monoamine hypothesis. All these noradrenaline, serotonin, and dopamine are monoamines. If patient has deficiency of these three, in this any of the neurotransmitter is limited, or if any of the neurotransmitter is deficient, patient may develop depression. Okay, so these are some factors or some causes which will cause depression. Okay, and now let us try to see how exactly this depression is diagnosed. Okay, see, based on the signs and symptoms, depression will be diagnosed. Anyways, the diagnosis of depression is not so easy. Actually, the psychiatrist will be diagnosing depression based on the we have diagnostic and statistical manual of mental disorders, which is also called DSM. So DSM, it is a manual, diagnostic and statistical manual of mental disorders. It is called DSM. Actually, we have these manuals. We have so many manuals. So right now, the updated manual for DSM is DSM 5. So right now, the present this DSM 5 is recently updated in 2013. Okay, 2013th edition is this DSM 5. Actually, this is the 5th edition. Okay, 5th edition is DSM 5. Recently it is updated, and from this 2013th edition, again it is in 2022, it is updated as DSM 5 TR karke. Okay, so this is the recent, very few changes were made in this DSM 5. Okay, so DSM 5 is nothing but it is the diagnostic and statistical manual. In this, all the parameters will be included. So based on the parameters which are included in DSM, patient will be diagnosed with psychiatric conditions. Like we have so many psychiatric conditions. Patient will have Alzheimer's, patient will have schizophrenia, patient will have obsessive compulsive disorders, patient will have mania, patient will have depression. So based on the parameters which are included in DSM, patient will be diagnosed. Okay, so anyways, we are not diagnostic specialists, will not go in detail about all these DSMs. One thing you have to remember, see, first DSM, first diagnostic and statistical manual, first manual was published in 1952. We remember this. This is DSM-1. DSM-1 was published in 1952, and DSM-2 edition was published in 1968, and DSM-3 is published in 1980, and 4 is published in 1994. Okay, the year which I was born. So 1994, fourth edition was published in 1994, and the 5th edition is published in 2013, and recent edition is updated in 2022 as DSM-5 TR. Okay, so these are some basic things we need to understand about depression. Okay, so yes, now these are, I explained you, the main cause for depression is biologic cause, right? The main cause for depression is biological cause. Usually some psychiatrist, what they see, if anybody has depression, they found that patient is having deficiency of serotonin. So this is the structure of serotonin. It is the neurotransmitter. All these neurotransmitters are monoamines. All these neurotransmitters will have single amino group. So they are called monoamines. So the structure of this is serotonin, and this is noradrenaline. Okay, and this is dopamine. So deficiency of serotonin or reduced synthesis or reduced release of serotonin or decreased synthesis of noradrenaline or dopamine. All these three neurotransmitter. If patient has deficiency, patient will develop depression symptoms. Okay, patient will have depression. So now you see, if anybody has depression, so being a clinical pharmacist or being the medical professional, our main objective is to increase the production or increase the activity of these three neurotransmitters: serotonin, noradrenaline, and dopamine. Yes or no? If we can increase any of these neurotransmitters, we can improve the patient's symptoms. Our main objective is to increase the production or presence or release of these neurotransmitters. Now you see, for this we have so many pharmacological drugs. I think you all are following me. Yes? Are you all? Yes. यहाँ यहाँ से ध्यान से सुनो सब लोग, यहाँ से बहुत इंटरेस्ट आएगा और बहुत अच्छा रहेगा. देखो, एक चीज पता चल गया कि डिप्रेशन इज कॉज्ड ड्यू टू द डेफिशिएंसी ऑफ सेरोटोनिन, नॉरएड्रेनालिन, डोपामाइन. ये चीज याद रख लो. नाउ आई विल ट्राई टू एक्सप्लेन यू अबाउट ईच एंड एवरी ट्रांसमीटर इन डिटेल. Okay, first neurotransmitter is serotonin. Okay, see, one thing we should understand, serotonin is very very important in our body. Actually serotonin is also called 5-hydroxytryptamine. ये चीज सबको पता है. This 5-hydroxytryptamine is synthesized from tryptophan. That process I'll explain you. This 5-hydroxytryptamine falls on 5-HT receptors. It falls on 5-HT receptors. You know, there are so many 5-hydroxytryptamine receptors. 5-HT receptors. We have 5-HT1, 5-HT2, 5-HT3, 5-HT4, 5-HT5, 6, 7. And in 5-HT1 we have so many subtypes: 5-HT1A, 1B, 1C, 1D, 5-HT2, 5-HT2A, 2B, 5-HT3. Very important. 5-HT3 receptor, when it is activated, it will cause emesis. Okay. And we have one very very famous drug called ondansetron. Ondansetron is 5-HT3 receptor antagonist. Okay, so like that we have so many 5-hydroxytryptamine receptors. एक receptor का location बहुत critical है. It is not very easy to remember all those, but एक चीज याद रख लो, serotonin binds on different serotonin receptors. Serotonin means 5-hydroxytryptamine. Okay, serotonin binds on different 5-HT receptors and it will cause so many actions. What it does, you know, it will cause modulation of mood. Okay, it will increase excitation, it will cause pleasure, it will improve sex drive, it will improve patients sex pleasure. Okay, and it causes cognition, memory power बढ़ाएगा, it increases memory. Okay, and it induces vomiting through 5-HT3 receptor. It causes appetite or it maintains appetite, it handles appetite. Okay, all this there are different actions which are mediated by serotonin. Serotonin को एक एक्शन दो एक्शन करके नहीं है, सेरोटोनिन के बहुत सारे एक्शंस है. एक एक्शन, एक रिसेप्टर अगर पढ़ते बैठे तो इट गोस ऑन. ओके, बट वन थिंग यू रिमेंबर, सेरोटोनिन इज इंपॉर्टेंट इन मेंटेनिंग मूड and in maintaining sleep and in maintaining pleasure. First thing, serotonin is important in maintaining mood modulation. It maintains pleasure or it causes pleasure. Pleasure means happy feeling. So serotonin is also called happy hormone. You know, serotonin is also called happy hormone. Pleasure, happy, it causes happiness, it excites. Okay, अब देखो, if अगर आपको excitement है तो then only you can easily understand what I am explaining or what teacher is explaining. If you are not excited, if your serotonin is not released, you will be simply sitting idle, you will be thinking something, you will not show interest, anything. You are called depressed person. Okay, so serotonin is important as antidepressant. Serotonin is important antidepressant neurotransmitter. Okay, so these are different actions of serotonin. I think you all are following me. Now you see, let us try to understand the biosynthesis of serotonin in our body. Usually serotonin is synthesized from the basic amino acid which is called tryptophan. Okay, tryptophan is the basic amino acid. From this tryptophan, usually this tryptophan is converted into hydroxytryptophan. Okay, 5-hydroxytryptamine बोलते हैं, with the help of tryptophan 5 mono oxygenase tryptophan hydroxylase करके enzyme, and this enzyme converts 5-hydroxytryptophan 5-HTP बोलते हैं. Again 5-HTP is converted into 5-HT which is called serotonin or 5-hydroxytryptamine with the help of 5-hydroxytryptophan decarboxylase aromatic L-amino acid decarboxylase. ये सब एंजाइम के नाम, ये सब it's not necessary for us to remember, but understand serotonin is synthesized from a basic amino acid called tryptophan. Okay, initially it is converted into 5-HTP. 5-HTP is again converted into 5-hydroxytryptamine, and this 5-HT will go and bind on the 5-HT receptors, and with that it will show many actions like it maintains mood, it maintains pleasure, it maintains sleep, all. Okay, all these different psychological mental actions will be maintained by serotonin. And now you should understand, when serotonin is released, serotonin is metabolized by very very important enzyme which is called monoamino oxidase. Okay, monoamino oxidase enzyme breaks down serotonin. Okay, serotonin into 5-HIAA जो भी है उसका नाम. You have to understand this enzyme. This enzyme is very very important. Why? You will understand in pharmacology. Okay, so this is the general step of serotonin. Serotonin, how serotonin is synthesized and what is the fate of serotonin in the body. Now you will try to understand more basic things. Now you see, I will try to explain you very clearly. See, just this is serotonergic presynaptic nerve and this is serotonergic postsynaptic nerve. Okay, serotonin is releasing here, right? The synthesized serotonin is releasing into the synapse. Serotonin is 5-HT. Okay, this 5-HT will go and bind on the 5-hydroxytryptamine receptors which are located on the brain as well as on the tissues, wherever, whatever. When 5-hydroxytryptamine binds on this receptor, it will show the actions. Okay, all the actions are related to mood actions. Okay, now you see, this 5-hydroxytryptamine, after showing its action, immediately after release, this will go back. This 5-hydroxytryptamine will reuptake back into the presynaptic nerve through one channel which is called serotonin transporter, in short it is called SERT. SERT, ध्यान से सुनो सब लोग. 5-hydroxytryptamine or serotonin, when it is released in the synapse, it will show its action, and after some time it will go back. It will be reuptaken by the presynaptic nerve through the channel or through the transporter which is called serotonin reuptake transporter, or simply it is called SERT. You have to remember this term, SERT. SERT is the channel through which the released serotonin will go back into the presynaptic serotonergic nerve. Clear, everybody? And see, when serotonin reaches here, serotonin means 5-HT. When serotonin reaches here, now this 5-HT, what it does? This 5-HT will be metabolized by MAO, monoamino oxidase. Clear? Now you see, depression is nothing but reduced amount of serotonin. Our main objective is to increase serotonin concentration in the synapse. Yes, in the synapse we have to increase the 5-HT concentration. Now what we have some drugs which are called serotonin reuptake or selective serotonin reuptake inhibitors. ध्यान से सुनो सब लोग. We have some drugs which are called SSRIs. They are also called selective serotonin reuptake inhibitors. SSRIs का function क्या है? You know, SSRIs will go and they will inhibit this transporter, this SERT transporter. We have some drugs called serotonin reuptake inhibitors. First, let us try to see the examples of SSRIs. Okay, in SSRIs we have fluoxamine. आप लोग सुने होंगे these names. I will try to write here. Fluoxamine. We have citalopram. ड्रग के नाम याद रख लो, citalopram. And we have citalopram. We have sertraline. We have paroxetine and dapagliflozin. Here also we can see some examples: fluoxetine, sertraline, paroxetine, fluoxamine, escitalopram. Okay, and यही नहीं, इसके साथ और बहुत सारे examples we have. We can't study all the examples. Okay, so these are the important examples in selective serotonin reuptake inhibitors. In this, one thing you have to remember, fluoxamine is very very important selective serotonin reuptake inhibitor. Fluoxamine is having long duration of action. Because of this reason, it is commonly preferred drug. Okay, and all these are not only given for depression, they are also used in other mania condition. They are also used in obsessive compulsive disorder conditions. Wherever psychiatric condition is there, ये uses बाद में देखेंगे. Now you see, these selective serotonin reuptake inhibitors, what they do, you know, their mechanism is very simple. These drugs will go and inhibit SERT. SERT is serotonin reuptake transporter. So this channel is blocked. When this reuptake channel is blocked, what will happen? This serotonin which is released in the synapse will try to increase. The action of serotonin will be increased. Yes or no? If we inhibit the reuptake, if we inhibit the reuptake channel, what happens? The serotonin which is released in the synapse, its concentration will increase and we can increase the actions of serotonin, and through that the depression symptoms can be relieved. Yes? Understood, everybody? Now you see, it is very simple. Selective serotonin inhibitors, their examples we have seen, their mechanism we have seen. Now you see, you have to remember the adverse effects. Very very important. Selective serotonin reuptake inhibitors के adverse effects क्या है? Adverse effects, अब बोलो आप लोग, adverse effects क्या होंगे बोलो? What will be the adverse effects of selective serotonin reuptake inhibitors? Because they are increasing, they are increasing, they are increasing serotonin. So see, listen carefully, everybody. Side effects of serotonin, selective serotonin reuptake inhibitors. Number one, it will cause insomnia. They will cause erectile very very important, erectile dysfunction. Yes, Prajwal. Very good. They may cause nausea, vomiting, and diarrhea also. They may cause nausea, vomiting, diarrhea. They will increase nausea, vomiting, and diarrhea. And this is very important. That's why selective serotonin reuptake inhibitors should not be given in active, sexually active persons, because they may cause erectile dysfunction. And it may also, if continued, uh, if treatment is given for prolonged period of time, it may cause impotence. Impotence. Along with this, yeah, these are the common adverse effects. और कुछ है तो these are main, we have to remember these enough. इसके साथ centrally related adverse effects are seen. Mood disorder हो सकता है if normal patient takes, and irritation, sometimes patient will have irritation, simply irritation. ये सब चीज़ें देख सकते हैं. So these are some adverse effects of serotonin, selective serotonin reuptake inhibitors. I think this point is clear to you. Okay, ये एक basic चीज़ पता चल गया है सबको. Now you see, now we'll go to the other neurotransmitter. इसमें और कुछ है या. Now we'll try to understand about noradrenaline. This is the second very important neurotransmitter which is associated with depression. See, we have not seen about adrenergic drugs till now. Anyways, that concept also we will see. But before that, I'll try to give some basic things about noradrenaline. See, we have parasympathetic and sympathetic nerves, right? So this is, just imagine this is a sympathetic nerve. Sympathetic nerve. Sympathetic nerves are those nerves which will release noradrenaline, okay? Or adrenergic, इसको adrenergic nerve भी बोल सकते हैं. This is presynaptic sympathetic nerve, presynaptic sympathetic nerve, and this is postsynaptic sympathetic nerve. See, actually there is a basic amino acid which is called tyrosine. Tyrosine, ये याद रख लो, tyrosine and tyramine, very very important. Tyrosine and tyramine, याद रख लो, tyramine बहुत important है, patient को मार भी सकता है. This one, tyramine के बारे में. Now you see, tyrosine is the basic amino acid. It is available in most of the foods. It is the essential amino acid. This will be easily absorbed into the presynaptic nerve through active transport, and this tyrosine is converted into dopa, which is called dopa, by very important enzyme called tyrosine hydroxylase. Tyrosine hydroxylase. Tyrosine hydroxylase converts tyrosine into dopa, and this dopa is again converted into dopamine by dopa decarboxylase. Okay, dopa decarboxylase. And the dopamine, see, ध्यान से सुनो, the dopamine will try to enter into the vesicle. This dopamine will go and enter into the vesicle. Actually, we have some vesicles here in the presynaptic nerve. This dopamine goes into the vesicle. And in the vesicle, we have one very, very important enzyme which is called dopamine beta hydroxylase. In the vesicle, we have dopamine beta hydroxylase. So this enzyme which is present in this vesicle, what it does, it will convert dopamine into noradrenaline. And noradrenaline will be stored in the vesicle itself. When this sympathetic nerve is depolarized, what happens when sodium or potassium, especially sodium ions, enters into the sympathetic nerve? When it is depolarized, it will release noradrenaline in the synapse. Okay, this is the general physiology we already know. So when noradrenaline is released, noradrenaline is acting on alpha and beta receptors. We have alpha 1 and alpha 2. We have beta 1, beta 2, and beta 3. We have 5 different types of adrenergic receptors. So when noradrenaline falls on these receptors, it will show all the actions, like on the cardiovascular system, it increases blood pressure, and on central nervous system, it causes excitation, it causes tremors on the skeletal muscles, it increases heart rate, it increases AV conduction velocity. Okay, बहुत सारे actions है. All CNS stimulant action भी रहता है इसका, CNS stimulant action initially, and after, if it is continued, it may cause confusion in the CNS system. Okay, तो ये सब चीजें we can see. See, in depression, the neurotransmitter hypothesis, the second neurotransmitter, if noradrenaline deficiency is seen, patient may develop depression. We have seen, right? So देखो, so this is the general physiology of noradrenaline. We have some drugs which are called selective noradrenaline reuptake inhibitors. ध्यान से सुनो, we have some drugs called selective noradrenaline reuptake inhibitors. See, when noradrenaline is released here, Noradrenaline, same like serotonin, it will be reabsorbed back into the presynaptic nerve through the channel, through the transporter which is called noradrenaline transporter, which is simply called as NET. Okay, same like serotonin, noradrenaline will be reabsorbed back. So there are some drugs called selective noradrenaline reuptake inhibitors. So when these drugs are given, what they'll do, they will inhibit this NET, and through that it will increase the concentration of noradrenaline which is released in the synapse, so that it will stop the reabsorption. And if noradrenaline is reabsorbed back, what will happen? The noradrenaline which is reabsorbed back, that noradrenaline will be immediately metabolized by monoamino oxidase. Yes, so monoamino oxidase enzyme, same like serotonin, it also metabolizes noradrenaline. Actually, monoamino oxidase ke andar we have monoamino oxidase A and monoamino oxidase B, that I'll explain you. But as of now, you understand, when noradrenaline is reabsorbed back, it will be metabolized by monoamino oxidase enzyme. Second year wale, are you all following me? Confusion is में? It is very new concept for you, that's why I'm going very slowly, I'm repeating the points. अगर किसी को confusion आ रहा है तो you should ask me. Okay, so see, so far what we have seen, till now we discussed about two neurotransmitters. First one is serotonin, and we also discussed selective serotonin reuptake inhibitors, and the second one is noradrenaline, and we have selective noradrenaline reuptake inhibitors. And in selective noradrenaline reuptake inhibitors we have some examples. Try to remember the names. Venlafaxine, you might have heard. Desvenlafaxine, and daloxetine. These three drugs you remember enough, और बहुत सारे दूसरे drugs भी है. Okay, so this selective noradrenaline reuptake inhibitors, these drugs will inhibit the reabsorption, and through that it increases noradrenaline and it will decrease the symptoms of depression. Along with antidepressant action, याद रख लो सब लोग, along with antidepressant action, selective noradrenaline reuptake inhibitors also has very very important action, which is it will be useful for neuropathic pain. If anybody has peripheral neuropathy, diabetic neuropathy, or vitamin B12 neuropathy, whatever, injury due to stroke or anything, in that cases, if patient has neuropathic pain, selective noradrenaline reuptake inhibitors are drug of choice. Along with antidepressant action, they also has neuropathic pain actions. And now you tell me, what are the adverse effects of selective noradrenaline reuptake inhibitors? What are the adverse effects of selective noradrenaline reuptake inhibitors? Adverse effects क्या है? Same. Adverse effects are very very similar like selective serotonin reuptake inhibitors, and along with that adverse effects, it will have hypertension. It will have hypertension and it increases heart rate, because all adrenergic actions can be seen with selective noradrenaline reuptake inhibitors. Clear? All sympathetic actions can be seen. Tremors रहेगा, tachycardia रहेगा, heart rate बढ़ जाएगा, patient will have hypertension. All adrenergic actions, alpha 1, alpha 2, beta actions can be seen. Okay, so this is about selective noradrenaline reuptake inhibitors. Clear? And along with this selective noradrenaline reuptake inhibitors, along with this, they also sometimes inhibits the reuptake of serotonin. They also tries to inhibit the reuptake of serotonin. Okay, so they also can be called as serotonin noradrenaline reuptake inhibitors, like that also they can be. So they are having dual action. Okay, so that important point you have to remember. Now next we'll try to see next neurotransmitter क्या है बोलो. What was the next neurotransmitter? Dopamine. Very good. See, for dopamine we have monoamino oxidase inhibitors. Before that, let me tell you dopamine drugs. Now let us try to see, there is the third category of antidepressants, which is called tricyclic antidepressants. Very very important. सब लोग बहुत ध्यान से सुनना. This is very very important. Tricyclic antidepressants, because they are having very very important adverse effects. See, tricyclic antidepressants, I'll try to tell you some examples. Remember the examples as with this mnemonic: depressant, DEP, depressants, antidepsy. Okay, so this is the mnemonic of examples of tricyclic antidepressants. In that, A represents amitriptyline. याद रख लो सब लोग. एंटीडेप्सी, A represents amitriptyline. amitriptyline के साथ और एक भी है amoxapine. You can remember one also. And N represents nortriptyline. सुने नाम ये सब ड्रग्स. Non-triptyline. When you go to psychiatry department, all these drugs you will come to know. Okay, A represents amitriptyline, amoxapine. N represents nortriptyline, and T T represents trimipramine. T represents trimipramine. Trimipramine. Okay. And I represents imipramine. I represents imipramine. All pramines, imipramine. And here D represents doxepin. This is different. Doxepin. That's why it is separate. Doxepin. Doxepin का भी एक important function है. And E represents DE decipramine. कहीं तो भी लिख लो, थोड़ा confusion रहेगा, but I'm just trying to tell you the examples of drugs. And P represents protriptyline. Protriptyline. And C represents clomipramine. Okay. So antidepsy. A represents amitriptyline, N represents nortriptyline, T represents trimipramine, I represents imipramine, D doxepin, and E deoxypramine, P कहाँ गया? Yeah, protriptyline. P is protriptyline and C is clomipramine. Okay. So these are the examples of tricyclic antidepressants. So see, they are called tricyclic antidepressants because they all the chemical structures are having tricycles in their main moiety. Okay, they are having tricycles. That's why they are called tricyclic antidepressants. And in triptyline you can remember this, like this also you can remember tricyclic में triptyline में amitriptyline, nortriptyline, protriptyline, and imipramine में imipramine, decimipramine, clomipramine, and doxepin, and these are different with triptyline and imipramine, but everybody are having tricycles in their chemical structure. So you can see the chemical structures here. We have different types of tricyclic antidepressants: amitriptyline, clomipramine, decipramine, protriptyline, doxepin, imipramine, nortriptyline. Okay, so these all drugs are tricyclic antidepressants. Now you see, अब मजा आएगा, देखो सब लोग ध्यान से सुनो. Everybody should listen very very carefully here. First point, we try to understand that tricyclic antidepressants are having 3 cycles in their chemical structure, and they are used as antidepressants, and some examples we have seen. Clear? Now you see, mechanism of action of tricyclic antidepressants is very very important. Mechanism of action of tricyclic antidepressants are very important. Why? See, it has 6 mechanisms. Tricyclic antidepressants are having 6 mechanisms. Number 1, ध्यान से सुनो सब लोग. Tricyclic antidepressants are having 6 mechanisms. Number 1, it will inhibit first mechanism, it will inhibit the noradrenaline reuptake transporter, NET. Okay, I told you to remember NET. NET is noradrenaline transporter. So noradrenaline will be reuptaken through this transporter. If this noradrenaline reuptake transporter, I mean this channel is blocked, inhibited, what will happen? It will increase noradrenaline. Okay, and when noradrenaline is increased, it can decrease the symptoms of depression. Okay, so this is one mechanism. Tricyclic antidepressants का first mechanism क्या है? It will inhibit noradrenaline transporter, noradrenaline reuptake transporter, and by that it increases the noradrenaline in the synapse. Now, second mechanism. See, based on these mechanisms, you should be able to tell the side effects of tricyclic antidepressants. Very very important. Second, it will try to inhibit SERT. Just now I told SERT. Serotonin, selective serotonin reuptake transporter. Okay, when this transporter is inhibited, it will increase serotonin, and through that it will be helpful in depression. That is second mechanism. And third mechanism, tricyclic antidepressants will inhibit muscarinic receptors. All muscarinic receptors. If muscarinic receptors are inhibited, what will happen? Yes, who is anti-muscarinic agent? Along with tricyclic. Yes, atropine. Very good, excellent, atropine. So tricyclic antidepressants are having atropine-like actions. Yes or no? Tricyclic antidepressants are blocking muscarinic receptors. That's why they are having atropine actions. No, atropine actions क्या है? Dry mouth. Patient's mouth will be dried. Patient will have constipation. Patient will have tachycardia. Patient will have all atropine के जो भी adverse effects mechanism है, that actually see, we need first mechanism and second mechanism. Third mechanism is not required for us, but this is extra action of tricyclic antidepressants which will cause adverse effects. Okay, number 4, fourth mechanism of tricyclic antidepressants, what they do, they will block alpha 1 receptors. Tricyclic antidepressants will block alpha 1 receptors. In previous class in BPH I explained you. Alpha 1 receptors कहाँ रहते बोलो, कोई बोलेगा alpha 1 receptors? Alpha 1, ONE. Just remember ONE. O means it is present on blood vessels. N means it is present. It is located at the neck of. It is present at the neck of prostate gland. It is present at the neck of urinary bladder. And it is also present at the neck of gastric or intestines. Okay, and E means eyes. It is located in the eyes. In the eyes, alpha 1 receptors will cause mydriasis. In the prostate gland or in the urinary bladder and in the gastric tissue, it will increase the sphincter tone. Through that, it will close the sphincter of gastric gland, it will close the sphincter of bladder, and through that, what it does, it will stop urination and it will stop defecation. Okay, and in prostate gland, it will cause urinary retention. It will cause prostate, same urinary retention. And in blood vessels, it will cause vasoconstriction. So alpha 1 receptor के actions है ये सब. अब देखो, when tricyclic antidepressants are given, it will block alpha receptors. So what will happen? Patient will try to have hypotension due to vasodilatory action, and in eyes it causes meiosis, and at the neck of all this prostate, urinary bladder, all actions will be relaxed. Urination हो जाएगा और defecation हो जाएगा. Okay. So this is the fourth action. कितने mixed actions है देखो. Now fifth action. Are you all following me? Actions of tricyclic antidepressants. Are you all following? Yes. Now you see fifth action of tricyclic antidepressants. They have H1 blocker activity or simply antihistamine activity. Antihistamines, what they do? They will cause sedation. They will cause antihistaminic actions. Okay, confusion होगा एक बार. Mainly sedation. Antihistamine action is also there. And very important sixth action याद रख लो. It will increase the sensitivity of convulsion, and through that what it does, it will precipitate. It will precipitate convulsions. So antidepressants, these tricyclic antidepressants are contraindicated in what? Contraindicated in epilepsy. They are contraindicated in epilepsy or if anybody has convulsions, stroke or CNS problems. Okay, so these are 6 mechanisms, 6 actions of tricyclic antidepressants. Number 1, it will increase noradrenaline level, it will increase serotonin level, it will block muscarinic receptors, and it will show atropine actions, it will block alpha 1 receptors, it will cause fifth action antihistaminic actions, and sixth action it will precipitate convulsion. That's why it is contraindicated in epilepsy. Okay, so these are different mechanism of actions of tricyclic antidepressants. Okay, we have seen the examples of tricyclic antidepressants, mechanism of tricyclic antidepressants. Through that, it will improve the symptoms of depression. So adverse effects you can relate. Adverse effects क्या होंगे? All atropine adverse effects, and patient will have antihistaminic effects, and patient will precipitate convulsions. Remember this. Atropine actions. It will see very important. Tricyclic antidepressants are blocking alpha 1 receptors. That's why it may cause postural hypotension. याद रख लो. What is postural hypotension? In previous class we discussed alfuzosin, tamsulosin, prazosin, doxazosin. All those are alpha 1 blockers, right? So those drugs are having postural hypotension action by causing vasodilatory action. Okay, so these tricyclic antidepressants also has same actions like alpha 1 blockers because it is blocking alpha 1 receptors. Okay, so this is very important, and you should not forget that tricyclic antidepressants are contraindicated in epilepsy. Clear? So tricyclic antidepressants के बारे में कुछ clarity मिला अभी? भूलना नहीं. We have some drugs which are called monoamino oxidase inhibitors. Okay, first very important point. See, just now I told one thing you have to remember. Monoamino oxidase enzyme is present in GI tract. This enzyme is present in GI tract. It is present in liver. ध्यान से सुनो सब लोग. It is present in mitochondria of all cells, most cells, especially nerves. Okay, nerves means which nerves? Especially dopaminergic nerves, and also in other nerves, in adrenergic nerves also. It is present in adrenergic nerves and serotonergic nerves. जो भी है nerves पूरे में it is located. Monoamino oxidase enzyme is present in GI tract, liver and nerves. Clear? Understood this point? Now you see, in monoamino oxidase enzymes we have two isoforms. Number 1, monoamino oxidase A and monoamino oxidase B. ध्यान से सुनो सब लोग. We have two isoforms. Monoamino oxidase A, monoamino oxidase B. These are enzymes. Monoamino oxidase A is very important. It will metabolize serotonin, it will metabolize noradrenaline, and it will metabolize tyramine. Initially I told tyrosin की जगह पे बोला था. Okay, याद रख लो. A, mono amino oxidase A will metabolize means it will destroy serotonin, it will destroy noradrenaline, and it will also destroy tyramine. Now mono amino oxidase B enzyme especially metabolizes dopamine. Clear? Mono amino oxidase A metabolizes serotonin and noradrenaline. Mono amino oxidase B metabolizes dopamine. Now you see, tell me one point. We have some drugs, especially we have mono amino oxidase A inhibitors. We have some drugs mono amino oxidase B inhibitors. A inhibitors hai, B inhibitors hai, and we also have some drugs which will inhibit both. That means non-selective inhibitors. Okay, now you should tell me which mono amino oxidase inhibitor is very effective for depression. Number one, is it non-selective, or is it mono amino oxidase A inhibitor or B inhibitor? कौन सा ड्रग अपने को डिप्रेशन में यूज होगा? We have two isoforms. Some drugs will inhibit both. They are called non-selective inhibitors. We have mono amino oxidase A inhibitors which will inhibit only mono amino oxidase A, and through that serotonin and noradrenaline will not be metabolized and they will increase the action. And we have third category of drugs which will inhibit mono amino oxidase B particularly, and when this enzyme is inhibited, particularly dopamine will be elevated. Okay, so see, let me tell you some examples. Mono amino oxidase A inhibitors के examples we have moclobemide. नेम्स याद रख लो, ये सब कॉम्पिटिटिव एग्जाम्स में बहुत काम आएगा. ओके, and we have moclobemide, and along with that we have chlorgillin, and we have one particular drug called siligillin, rasagiline करके थोड़े ड्रग्स है. siligillin is mono amino oxidase B inhibitor. siligillin. Okay, and we have non-selective one, isocarboxazide, we have phenylzine, and we have tranylpramine करके बहुत सारे. Okay, all those examples are non-selective. Okay, we have non-selective blockers, we have mono amino oxidase A inhibitors and mono amino oxidase B inhibitors. Now tell me, which form of drugs are very effective in depression? Which one? Non-selective or particularly A selective or B selective? बोलो. Siligillin? Non-selective will be preferred actually. Non-selective drugs should be preferred because they are having they will increase the actions of 3 neurotransmitters. Siligillin is particularly useful in Parkinsonism. Blind point, gun point. Siligillin is rogopchin, Parkinsonism. Why? In Parkinsonism, dopamine is decreased. Actually, dopaminergic nerves are destroyed in Parkinsonism, and through that dopamine neurotransmitter is decreased. So siligillin, what it does, it will inhibit mono amino oxidase B, and through that it may increase the dopamine actions. So siligillin is rogopchin, Parkinsonism, and the monoclobamide and these drugs can be given in depression. Okay, and non-selective are usually preferred. Now you see, when mono amino oxidase A inhibitor and non-selective inhibitors are given, one very important adverse effect is seen, which is called cheese reaction. Okay, cheese reaction is very important adverse effect. See, I told, when non-selective enzyme inhibitor or when mono amino oxidase A inhibitor is given, these enzymes, what they are doing, they are metabolizing serotonin, noradrenaline, and also they are metabolizing tyramine. Okay, these enzymes are metabolizing tyramine. When patient takes non-selective mono amino oxidase inhibitor or mono amino oxidase A inhibitor, tyramine is not metabolized in the body. Yes or no? Tyramine is not metabolized in the body. And if any patient who is taking these drugs, in that patient, if patient takes some diet which is containing lot of tyramine ज़्यादा वाले अगर ले लिए तो tyramine concentration rapidly increases in the body, and through that what happens, tyramine will increase the adrenergic action, and what happens, immediately patient will have severe hypertension crisis में जाके patient stroke आके मर भी जा सकता है. Very important drug food interaction बोलते हैं इसको, drug food interaction. So when you are giving mono amino oxidase inhibitor, especially mono amino oxidase A inhibitor or mono amino oxidase non-selective inhibitor, never suggest patient to take tyramine rich food. Tyramine rich कहाँ पे रहता? all pulses. Pheromone is very rich in cheese. Pheromone is rich in all milk products and in breads. Okay, cheese के अंदर बहुत ज़्यादा रहता है. So those particular food items are not suggested to the patient because it may cause cheese reaction. Very very dangerous adverse effect. Clear? So this is about monoamino oxidase inhibitor. And one more classification is there. We have atypical antidepressants. Atypical antidepressants. This is also very very important. Atypical antidepressants के बारे में will continue in the next class.